Hello, so today we're going to be talking about distemper, which is the other thing or the other main component of the distemper parvo vaccine in dogs. So distemper is a viral infection that can be a little bit of a challenge because it looks like several other diseases. There really isn't a treatment and the testing is a little bit difficult. So distemper is typically passed where you either inhale, get material in the mouth, something like that, dog-to-dog contagious type thing. It can impact three specific body systems, usually the respiratory system, the GI system, and the nervous system. So you can see any of the clinical signs of those three systems in a distemper patient. Some of them only have one area that's impacted, some of them it'll be all three. Signs can be vomiting, diarrhea, lethargy, inappetence, coughing, respiratory infection, seizures, ataxia, stumbling, those kinds of things. Testing is a little bit of a challenge because there's no in-house test for distemper. You do have to send out a test, but thankfully most general respiratory panels now do include distemper if you ask for it. Now, treatment is also a little bit of a challenge for these dogs because there is no treatment for the base virus itself. You're just treating the clinical signs for the dog. You're trying to keep any vomiting under control, make sure they're not dehydrated. If they're having seizures, give them anti-seizure medications. Some of them need antibiotics for respiratory infections and whatnot. With treatment, the outcome is not always great for distemper patients because sometimes we cannot get the clinical signs under control. And there needs to be an understanding of if you treat a distemper patient and they get over the initial virus, they may still have long-term issues. We do see some dogs that will continue to have seizure issues, neurologic issues. Sometimes they'll get chronic issues with their teeth because the enamel or the hard part on the outside of the tooth can get damaged by a high fever that comes with distemper. We'll also see some dogs that have weird, it's called hyperkeratosis. It's real thickening on their paw pads as well. So it's a virus that we definitely want to vaccinate for because the vaccine is very effective for distemper and the disease is really a booger to work on. So get your pets vaccinated so we don't have to worry about that with distemper.